My name is Samalid Hogan, and I'm joined today by Kim Lee. Kim Lee from Miravista. Welcome, Kim. Thank you for joining me.
Thank you, Sam. So happy to be here. Thank you for having me.
Kim, why don't we start by you telling us a little bit about yourself and what Miravista is?
Sure. So and thank you, Sam. I am the Chief of Creative Strategy and Development here at Miravista Behavioral Health Center. We are located right here in Holyoke on Main Street. We were formerly Providence Behavioral Health Hospital, but just about 2.5 years ago, Miravista purchased this facility from the Trinity Health System. And so we've been operating as Miravista since April of 2021. And I have lived in Western Massachusetts, lived and worked in Western Massachusetts all of my life. And I'm very, very happy to call Hampden County home and to call Miravista my work home.
Thank you. Thank you, Kim. And can you tell us a bit about the programming and the services that Miravista offers?
Absolutely, Sam. Miravista Behavioral Health Center is operating both inpatient psychiatric mental health care as well as outpatient substance use treatment. So on the inpatient side of things, right now we have approximately 72 beds for inpatient adult care and adolescents. So we also treat young people between the ages of 13 to 17, and that is done inpatient for individuals who are experiencing a very acute level of need for their mental health. And then in adjacent to that, we have a very robust offering of outpatient addiction services. So individuals who may be challenged with an addiction to alcohol or any other substance can seek treatment here at Miravista, from outpatient counseling to an intensive outpatient program called an IOP. We also provide opioid treatment programming. So we are dosing through our clinic, methadone, Suboxone, Vivitrol, as well as Sublocade. So individuals can be treated here for a variety of substance use disorders, and they can do that in an outpatient treatment modality.
And is it typically the individual themselves that go to Miravista to ask for help, or is it typically a family member or someone else? How does it typically work?
Oh, it can happen in a variety of ways, Sam. So we have individuals who will go to our website and they'll fill out an inquiry form, or they'll send an email asking for more information, or they'll simply call. They'll call our main number, or they'll find my number online and they'll reach out themselves directly. But then absolutely, we have family members who call who want to know about what treatment options might be available for their loved ones, for their family, or for friends, perhaps for themselves. And then we also hear very often from organizations, from HR professionals, business owners who may want to assist an employee, a staff member, somebody in their workforce, but they're just not sure how to get treatment. So we hear from individuals who either themselves need the programming, or individuals who are interested in learning more about programming for somebody in their life.
Right. And are your services covered by insurance, or this is totally up to the individual to cover for themselves? Tell us a little bit about that in terms of financial assistance for some of the individuals out there who may be listening to this and like, that sounds, I need that help, but I don't know if I can afford it.
Right. No, we do, Sam. So we are contracted with nearly every commercial insurance provider that there is. So Maine Blue Cross Blue Shield, Tufts Health New England, Optum. In fact, we were just contracted with the VA Community Care Network, or VACCN, which means we're able to treat veterans now through our outpatient substance use programming. We've always been able to accept that insurance for inpatient psychiatric treatment, but now we're able to accept that insurance for outpatient substance use. So that's huge for us and huge for veterans who may need that type of assistance. But Mass Health, Medicare, Mass Health Tufts, we are credentialed with just about every large insurance carrier in Western Massachusetts, actually in New England.
That's good to know because you mentioned also that sometimes you get referrals from HR professionals or small business owners or just large business owners that are looking for help for an individual in their team who seems that they need more support that what they can get right in the workplace.
Right.
And so what would be the first step for them to take if they wanted to inquire about your services for someone in the workplace?
Oh, thank you, Sam. What a great question that is. So a big part of my role here at Miravista is to be a liaison with the community. So to engage the community in a way that's meaningful, not simply for Miravista, but meaningful for the community itself. So if we look at the business community, small or large, individuals within those companies may find it frustrating when trying to find services for their employees or for members of their staff. And absolutely, EAPs are a valuable resource, but they are only valuable if they're up to date and if they are credentialed or contracted with providers in the area. So you may have an EAP who is not aware that Miravista exists. In fact, we were just speaking with a company, a local company the other day, who had an EAP who referred an individual to us, but they were not aware, the company was not aware of Miravista being a resource. The EAP had not been helpful to them in that way. So,
and these are the programs that businesses they have a contract with for health type of programming for their employees. Is
that's right. So
that's what the
typically,
EAPs are?
so the employee assistance programs are usually working with larger organizations. But for companies, smaller companies where you maybe have 10 employees or less, contracting with an AAP or paying for the assistance of an EAP may not be something that fiscally you're able to budget for. So if you're a smaller business, a small company, you have just a few employees, but gee, you're noticing one of the individuals who was a very consistent employee, came to work on time, now suddenly seems to be coming in late, and that's when they do come into work. Their behavior seems to be not consistent with what it used to be. Productivity is now lower. Could be that individual needs assistance. Could be substance use. It could be mental health. And so I'm a local resource here at Miravista to be able to help companies, smaller companies, navigate those resources for their workforce.
So I have two other questions for you. Number one, do you provide assistance in a variety of languages as well, not just English, or is there limited?
No, English, Spanish are our primary, but we do contract with a variety of translation services. So if there were employees who might be, let's see, Vietnamese, or could be from another, whether it would be Russian or Iranian, that there would be translation services that we would have available to us here to help make that language connection.
Great, that's good to know. And my other question was going to be, it's hard to bring up this type of resource to a coworker or a team member without feeling a little bit awkward, just to say, hey, you might need help from Miravista. Why don't you check it out? Like, that's just, I don't know that many of us will feel comfortable doing that. So
Right.
how do you recommend, whether it's supervisors, business owners, coworkers, how would you recommend that these resources are shared with their team and their staff? What have you seen done?
Oh,
How have you
that's
seen it done?
such a great question, Sam. And you're right. It is difficult. And sometimes it's difficult even in our personal lives, never mind our professional lives, right? Sometimes it's you want to ask a friend or you want to ask a family member, how they might be feeling. But when they answer, are you prepared? Are you prepared for them to say, I'm struggling emotionally, or I'm struggling with an addiction? So we recommend working to create an environment or a workplace that's conducive to mental health, to having a conversation about mental health. So we recently launched a brand new website. I should say, we recently launched a brand new section on our website, which is a resource just for human resource professionals or for presidents, CEOs, individuals who are responsible for a workforce. And one of the things we talk about in that section is creating an environment, a workplace environment that's supportive of having those types of conversations. So, for example, maybe inviting Miravista in to do a lunch and learn on substance use resources in Western Mass, or another lunch and learn might be on understanding mental health and how to find help in Hampden County. So by having that dialogue, by having that conversation or those conversations, hopefully it lends itself to having an easier talk with an employee who might say, hey, I'm so glad that you brought in Miravista because my daughter has been struggling or my wife has been struggling. So those conversations get easier when you create a workplace culture that really does support conversations around mental health and substance use, helping to reduce that stigma.
Great. And geographically, you're located here in Western Mass. What is the geographic area that Miravista covers?
We cover all of Massachusetts, Sam. So we're located here in Western Massachusetts, but we have individuals coming to us for inpatient treatment from the eastern part of the state. And we have individuals in our outpatient substance use programming who come to us from Northampton or East Hampton, Chicopee, Longmeadow, East Longmeadow. And we also provide transportation to our outpatient substance use programs. So if employers have an individual who would like to engage in substance use treatment, but their partner takes the car to work every day and they work at home and they're not sure how they would get to Miravista, we provide transportation within a 25-mile radius, and that's free of charge and regardless of insurance.
Great. And again, just to reiterate, you're located in Holyoke, Massachusetts.
We
Where you're
are.
primary.
We are located in Holyoke, Mass. Just about 500 feet from the on-ramp to the Mass Pike.
Excellent. Great. Thank you so much, Kim. And the very last thing before I let you go, for folks to get connected, you mentioned your website.
Yes.
It's a great place to inquire and request information about the programs that you offer. Is there a phone number or some other contact information you'd like to share for folks to know how they can connect with you or Miravista?
Yes, there is. There is. And so our website is miravistabhc.care. And my phone number is 413-264-3042. And my email is klee@miravistabhc.care. So any one of those emails, phone numbers, or website addresses will get people directly to Miravista and hopefully to the information that they need to be helpful.
Great. Thank you so much, Kim, for sharing with us about this important and valuable resource here in our area. And happy holidays to you.
And happy holidays. Thank you for the invitation, Sam. Take care.
Thank you. Bye.
Bye.